Hi, I'm Susun Kuna, project manager of the ALX Kaizen team. I want you to take time and imagine the following scenario. You are gravely ill and seek immediate medical attention. The healthcare facility you arrive at, immediately when they pull up your file, they find your name, history, critical note. You are allergic to peanuts. The doctor, with this information, is able to administer life-saving medication. How would that moment feel, knowing that accurate, accessible records helped save your life? And this is what we have chosen for our global challenge and global opportunity. This is our team and our team members. We have chosen healthcare, particularly the filing system. How are people affected? Patients are affected, information management teams, and healthcare professionals. Why does it matter? It leads to records not being stored accurately, duplicates, acquire a lot of space that can be used for other stuff. But most importantly, it increases patient waiting time when their files cannot be retrieved. Before us is a graph. This graph shows the number of admissions between public and private healthcare system and the totals in green. In blue, which is the public healthcare system, we can see from 2020 to 2024, it is increasing year on year. In a survey that was done for 419 public clinics, 40% of users said that retrieving files contributed significantly to longer waiting times. Out of 22,000 patients that participated. Fact number 3, files lost per month. The graph before us shows how many files are lost with the manual system and the digital filing system. With the manual system, 18 to 30 files are lost per month. Whereas with the digital system, without its flaws, only 1 to 2 files are lost. Our proposed solution: a digital patient record app that stores medical files electronically, accessible only by authorized doctors and nurses. This will be usable across multiple hospitals, meaning that even if a patient should go and live in another province, healthcare professionals in that area are still able to access it from the private system, from the public healthcare system. Why we believe it will work? Currently, with the manual files, things are slow, messy, and get lost. But putting files on a computer, doctors can find information fast, patients won't have to wait long, and more space has been cleared because no more filing, no more files placed in a room, but that space can be used for other things in the hospital or clinics. Our solution is a wireframe that we've given and has been tested by users. If we can just look at the dashboard, healthcare workers can see the total number of patients that they have in their system and the total that came in that they seeking medical attentions. They also have an opportunity to upload new patients. What has been the feedback that they've given us with real testers? On bullet point number 3, they said the system must be able to work even when it's offline, meaning they must be able to retrieve the information and they must be able to upload. Then when they are online, it automatically updates and syncs to our database. What we'll do with the funding that we've received, we will fully develop a functional, secure, and user-friendly application that enables healthcare workers to record, update, and manage patient information. We'll also have a cloud database that's fully functional and has strong security and complies with the national health regulations. The funding will also allow us to scale it even to rural areas as time goes. Lastly, funding will allow us to supply clinics with the appropriate digital devices, which can store a lot of information on the days they are offline. Together, let me and you help prevent the situation we see before our eyes. Let's come up with a digital funding system that improves patients' experience and greatly improves the efficiencies of our public hospitals. Thank you.